Hi student, today lecture 11, Hospital Hygiene. Medical institutes are hospitals, outpatients clinic, antenatal and children clinics, maternity hospital, dispensaries, medical assistant, obstetric unit in a rural area, medical units, center of hygiene and epidemiology and others. These institutes are assigned to carry out effective action on decrease or morbidity rate and health strengthening of the population, while the organization of qualified medical care based on the newest scientific achievements in treatment, diagnostic, and prophylaxis of disease. The purpose of norms and the rules developed by hygiene of treatment and prophylactic institutes that promote recovery of patients, the prophylaxis of spreading of intra-hospital infection, creation of the safe working condition of the medical personnel. The task of hygiene of treatment and prophylactic institutes, improvement of intra-hospital hygienic condition, decrease to minimum distribution of intra-hospital infection. At the same time, medical institutes in the workplace of medical and technical personnel. In the process of diagnostic and treatment, they are often related with different kinds of medical equipment, which may be source of ionizing and non-ionizing radiation, for example, laser, ultrasound, light, medicines, which may have adverse effect on the health of personnel, and also extreme condition, stress and night duties. So the work character requires creation of adequate labor condition which eliminates the possibility of occupational disease. Creation of necessary hygienic condition in hospitals depend on the object location in the settlement, the ground area and zoning, a layout and interior finish of building, sanitaries and a sanitary hygienic regime. System of hospital building: centralized, decentralized, and mixed. The centralized system is characterized by location of the main units in one multi-story corpus or in several interlocked buildings. In the system, the pathology-anatomic units, polyclinic, economic, and administrative corpus are usually placed in independent buildings. Advantages of centralized system building: provides more comfortable communication between units, decrease of time waste for patient and personnel moving, fast delivery of food from nutrition unit to the wards. In centralized system of hospital building, are located separated in pavilions corpus of low number stores. Advantages of decentralized system building: good isolation, prophylaxis of intra-hospital infection is simplified, condition for patient to stay on fresh air, maintenance of a medical regime. Disadvantages of decentralized system building: prolongation of all communication, redoubling of some kind of premises and equipment, complexity of medical service of patients, budget is more expensive. The mixed system is characterized by location of somatic, X-ray, psychotherapeutic, and clinical diagnostic units in one corpus. Infection, maternity, pediatrics, radiological, pathology-anatomic, economic units, and polyclinic are located in separate corpus. The system is the most prevalent today because it eliminates disadvantages of mounting it above. When the large multi-field hospitals building started, the mixed system has been modernized and named as block system. Recently, the most popular building system is the monoblock system. The various units are located in the one multi-story block, and the medical diagnostic units are positioned in the low number stories. In view of appearance of new methods of diagnostic and treatment in modern hospital, the biggest change had place in the medical diagnostic units of the hospital. Therefore, the new hospital's units are formed like reanimation, laser, rehabilitation, neurosurgery, burns, transplantation. The basic structural units of modern hospital are units of patient reception and exchange, wards unit, treatment diagnostic units, laboratory, the central sterilization unit, drugstore, nutrition unit, pathology-anatomic unit, administrative economic service, and laundry. Area for the hospital. There should be sufficient area for all buildings in the plan. The space of the area depends on the type of hospital planning, the number of beds in the hospital, the profile of that hospital. The area of the hospital must be with minimum sound pollution, good transportation routes, good water supply and drainage, away from factories. The distance between factory and hospital depends on the type of pollution and its toxicity, and take into consideration the direction of the winds in that area, if it is industrial area. There are next functional zones in the hospital area. Medical corpus for infection, not infection patient, pediatric, dermatovenerologic, radiological department, a maternity home, planting, polyclinic corpus, pathology-anatomy corpus, economical and engineering corpus. 50% of the area for building, 25% food premises and technical section, 60% of the area for natural lighting and ventilation, green zone. Hospital reception. Internal planning of the reception must protect the hospital against intra-hospital cross-infection. There must be a separate reception for children, patients with lung tuberculosis, and obstetrician. Reception and in main building. Daily number of visitors must be equal 10% of number of hospital beds in city hospital, 2% for tuberculosis hospital, and 12% for maternity. In reception, there is a small ward for patients with undiagnosed disease. The reception contains room, bathroom, laboratory for express analysis, rentgen cabinet, room for sister in duty, room for doctor in duty, and cloak room. The main part of hospital is a wards unit. Usually, this unit is planned in linear form, conveyed for auxiliary room planning, good observation of wards from the post of the nurse's duty, and sufficient insulation. The wards unit is the isolated set of premises for patients with leukemia disease. It consists of wards, medical, auxiliary, and economic premises, a corridor, and laboratory. Floor-to-ceiling height of ward and operating room should be not less than 3 and 3.5 meters accordingly. The cabin capacity to provide the double air exchange in 1 hour per every bed should be not less than 20 quadrat meter. Artificial ventilation should provide 80 cubic meter of air supply and derivation per hour. The microclimate of ward is also very important. The comfortable temperature is 20-22. The light coefficient in ward should be 1.5-1.6. The general artificial lighting of ward should be 75 lux by filament lamps and 150 lux by cut light. There is a special lamp in every ward. The distance between two beds should be not less than 0.91 meter. Also, the distance between bed and external wall or window should be not less than 0.81 meter. Except beds, there are bedside table, chair, table, wardrobe or coat rack and sanitary arrangement in ward. The walls of the as well as a corridor should be colored up to 1.8 meters of height by light oil paint, and above this mark by water paint or glide paint. Floors should be usually covered by linoleum. The width of a corridor should be not less than 2.5 meters for comfortable moving of beds, surgical transport. The pathology-anatomic corpus should be isolated from the wet corpuses and has isolated entrances and exits. The distance between pathology-anatomic corpus and wet corpuses should be not less than 30 meters. The operating unit. There are operating, preoperative, sterilization, anesthetic, and other rooms in the structure of a surgery block. Operating block could be placed in the isolated building or isolated corpus. The operating room for emergency surgery are placed in structure of reception ward. The orientation of operating room window should exclude the source east, and source west direction. Entrances to operating block for personnel should be organized through sanitary inspection room and for patients through sluice. There are septic and aseptic operating block with condition of strict zoning of internal premises, a sterile zone, a zone of strictly regime, a zone of dirty premises in the hospital. Surgical unit. The general requirements are the presence of good communication condition with operating block and diagnostic units, laboratory, rentgen, unit of functional diagnostic, the presence of adequate number of dressing room and treatment room, the presence of condition for post-operative stay in specially equipped wards, post-operative wards, the absence of condition for contact of post-operative clean patients and purulent patients with after reflex, the presence of purulent unit and special operating room for patients with supportive process. The rest patients are placed in clean units. The main feature of surgical unit is presence of an operating block and in large hospitals, the operating units. Infection unit. Infection patients can be very hazardous for patients with other disease and for personnel. Therefore, the treatment of them is conducted in infection unit of multi-field hospitals or in special infection hospital. There is a separate floor for every infection in that hospital or separate division in infection unit of multi-field hospital. For prevention of intra-hospital infection, the infection unit and infection hospital have some future considering a sanitary regime and planning solution. The sanitary regime includes the patient isolation, sanitary cleaning, disinfection of premises, utensils, equipment, linen. The planning solution of infection units and hospitals are based on separation of clean and dirty streams. The dirty stream is a moving of infection patients and all the process to their service. The clean stream is a moving of the personnel and patient discharged from unit. This isolation system allows of prevention and intra-hospital infection. The infection unit consists of boxes, semi-boxes, wards, and a neutral zone for doctor and nurses. The box is the most reliable isolated ward to prevent the intra-hospital infection. It consists of a complex of premises, entrance tambour, lavatory with a bathroom, ward, sluice with separate external entrance. The sluice uses box with central corridor, and this corridor is for the personnel to enter to the patient. There are a washstand, coat rack for doctor smokes, and built-in cupboard for food delivery in a sluice. Before exit from the box, into the central corridor, the doctor should take off his smock, wash his hands, and cleanse them by disinfectant solution. The used dishes washing and disinfection are made in box. To keep patient under observation, the part of the wall is a glass. Usually, the patient with unspecified diagnosis are placed in that box for 5 days to clear up a diagnosis based on result of laboratory and bacteriological analysis. Then the patient should be left in the box or moved to the ward. After treatment, the patient is discharged from the hospital and leaves the box through the external door, when the final disinfection should be done in box. Semi-box is the isolated ward consists of the same premises as a box, but without the external entrance. The patients can get to the semi-box through the central corridor. Only patients with leukemia infection can stay in the infection unit of semi-boxes. Child hospital. The area of hospital should be in healthy locality and not close to a factory or an unsanitary place. Protect the child against the negative influence of external factor. Prevention of intra-hospital infection, cross-infection, safety hospital environment. The particular future of child hospital. The green zone should not less than 50% of the hospital area. Hospital department contain secured, isolated room for the box, especially in department for children of 3 years of age and more. Department for different age, for children of 1 year reach 24 beds, and for senior children 30 beds. Complementary beds for mothers. Number of beds for mothers are equal to 50% of the number of beds in that ward, with bedroom, buffet, bathroom, and toilet. Special classroom for children in school age. Special playroom for children. The department must be under strict control against cross-infection by isolation the patient with suspected infection disease in secured rooms, box. If the department of children in the hospital for adults, it must be in separate building. In every section, there must be 2 highly secured or secured rooms with 1 bed. Hygienic requirement for sanitary engineering hospital equipment. Lighting, ventilation, heating system, hospital sewage. Lighting or human vision, visual acuity, the recognition ability, is the ability of the visual analyzer to recognize the smallest element of the object. Is determined by the smallest angle under which the 2 adjacent spots are recognized as separate. The visual acuity is conventionally considered to equal to 1 angular minutes. The visual acuity grows proportional to illuminance until it reaches 130–150 lux. When the illuminance is above that point, the visual acuity growth slows down. The insufficient illumination leads to the overstrain of accommodation system, overstrain of the visual analyzer, and for children and adolescents, their eyes has not yet formed completely. It may cause the myopia, short-sightedness, especially if they have the cognitional disposition. Practically, all life, except sleeping time, people pass in light condition. 2 kinds of lighting or illumination distinguish natural and artificial. Natural lighting, daylight, has a biological effect or exerts influence on all vital function. External factors that influence natural lighting in different premises, the territory latitude and its climate, number of sunny and closed days, season of the year and time of the day, when the premises are being used, existence of objects producing shadow, buildings, trees, hills, mountains, and others. Internal factor influence of the intensity of natural lighting. Name and function of premises. Window orientation, floor, type of natural lighting, light aperture location, number of window, their construction, clarity and quality of glass, existence of object producing shadow, floors and curtains, where windows sill high, distance from the window top edge to the ceiling, breathiness, reflection ability of the ceiling, walls, equipment, and furniture. The above-mentioned factors also influence the premises insolation regime. Insolation regime, the duration of exposure to a direct solar light. There are three basic types of insolation regime. It can also be influenced by a window's orientation. Insolation depends on local geographical latitude, orientation of building, light carriage wall of the cardinal points, shading of window by next building, size, form, and construction of light appear on the wall. There are three basic types of insolation regime: maximum, medium, minimum, and different variants of their combination and criteria. For example, the best orientation for hospital, vets, school classes, and children institute are source, source east, allowable, south, west, and east, unfavorable, west, north, west, north, northeast. According to the hygienic norm, the duration of insolation in residential areas, classroom, and other premises of similar function must be not less than 3 hours. Sufficient lighting of premises is necessary for creation of normal conditions for visual work and has general hygienic meaning. Insufficient or irrational lighting result in fatigue of eyes, central nervous system, decrease of mental and physical work capacity, development of some disease, in particular myopia of children, increase of traumas risk. Light energy acts on many physiological processes of organism. In all premises assigned for long stay of people, the lighting by direct and diffuse solar beams is necessary. Lighting should be intensive enough, uniform, matte, but not forming hard shadows. For estimation of lighting condition, the International System of Lighting value and units is accepted. Lighting is the density of light flux or illuminated surface. As unit of lighting, the lux is accepted. It means the lighting of surface of 1 quadrat meter by uniformly falling light flux of 1 lumen. The ultraviolet beams almost do not pass through usual window glass, but they pass through special enriched glasses. These glasses pass UV beams with a wavelength up to 300 nanometer. It is biological effect of light getting into premises. For evaluation of natural lighting in premises, the parameter as factor of natural lighting or coefficient natural lighting, the light factor, the angle of light falling, and angle of light aperture are determined. For example, norms for surgery room, daily factor not less than 2%. The light coefficient equal 1, 2, 1, 3. The angle of falling equal not less than 27 degrees. The angle aperture equal not less than 5 degrees. The artificial lighting is also necessary in premises, especially in case of insufficient or changeable lighting. With its help, it is possible to create a stable lighting intensity during the day. Source of artificial lighting: general, local, combined. General: the lamps are located uniformly in the top part of the premises. Local: the light flux from lamp is directed to workplace. For example, the work of watchmaker, jeweler, or stomatologist. Combined: when the general light is used jointly with the local. Very often it is necessary to use applied lighting when the insufficient natural lighting is supplemented with artificial. Today, the electrical lighting is mainly used because it provides sufficient and uniform lighting of premises without heat and byproducts of burning. The filament lamp is filled by inert gas, and the light energy is generated due to heat of tungsten filament during the electric current passing through. Last year, the fluorescent lighting is widespread, whereas the matte glass tube with mercury fumes inside. In the ends of the tube, the electrodes are soldered and the internal surface is covered with phosphorus. After switching off of electric current and heating of electrodes, there are mercurial spectrum with a lot of UV invisible beams are formed. These beams due to phosphorus are transformed to visible radiation of light. The fluorescent lighting has with certain advantages over filament lamps. Considering spectrum, they are close to solar spectrum, give soft, scattered light without shadow, and have small brightness. Sometimes observe the small stroboscopic effect revealed as pulsation of light flux are considered as disadvantages of a fluorescent lighting. There are lamps of direct, scattered, and reflected lighting. The lamps of direct light are usually filament lamps. Almost all light flux of these lamps is directed towards down, gives sharp shadow, and does not provide uniform distribution of the light. The bright glare of this lamp have a blinding effect. The bright source of light causes fatigue of eyes, adversely influence on nervous system, therefore the work capacity is reduced. The lamps of reflected light direct the most part of light flux to receiving, and when the light is reflected downwards, is the most appropriate type of lamps in hygienic sense because of uniform, soft, and pleasant lighting for normal vision. The lamps of scattered lamps are more widespread. They meet the hygienic and economic requirement. They provide the protection of eyes, bright light, and quite uniform distribution in all directions. Such kind of lamps are the lamps included in the bowl of matte glass and other more reflected types. They are widely applied at school. In addition to the general lighting, the local lighting are often arranged using the desk lamp and lamp bracket for this purpose. They create the lighting which exceeds of surrounding lighting. It helps for concentration of attention illumination surface. Ventilation. Regular ventilation of premises and public buildings provides timely removal of heat excess, moisture and adverse gasiform impurities accumulating in the air as a result of people's stay and different household process. Incidents characterizing ventilation in room. Necessary volume of ventilation, real volume of ventilation, necessary and real ventilation rate. Necessary volume of ventilation, amount of fresh air which is necessary for fanning a room per one person during 1 hour. For dioxide carbon amount should be a standard limit. Real volume of ventilation, amount of fresh air which really fanned to a room. Necessary ventilation rate, a number which shows how many times during 1 hour necessary to replace air of room. For dioxide carbon amount should be in standard limit. And real ventilation rate, number which show how many times during 1 hour air of room really is changed or removed from a room. The air of badly ventilated premises and other closed premises as a result of change in chemical and bacterial structure, physical and other properties can be cause worsening of health state, carrying of lung disease, heart, kidney disease. Is established that long-term inhalation of such air jointly with unfavorable temperature, humidity, and aeroionic regimes substantially influence our nervous system and overall state of human health. Main symptom: headache, loss of appetite, reduced working capacity. All of this is an evidence of great hygienic meaning of ventilation in premises and, as it's said by Edison, the pure air, the one of the first aesthetic requirement of human organism. Classification of ventilation system. In the hygienic practice, distinguish two types of ventilation system: natural, artificial, or mechanical. Natural divided to group aeration and through aeration, artificial, mechanical. Input ventilation. This kind of system of artificial ventilation system divided also to group: general, local, extract, general, local, and combined, extract and input ventilation. The value of required exchange of indoor air with outdoor air depends on number of people in the room, character of executing operation by them, and the room cubic capacity. This value can be determined with use of the different parameters. The one of them, widespread in sanitary practice, is the concentration of carbon dioxide. Ventilation should keep the concentration of carbon dioxide in the air of premises no more than 0.1%. This concentration is adopted as permissible concentration for usual living room, classes, hospital beds. Purity of the air in premises is the result of everyone providing with the needed volume of air, so-called air cube, and regular substantiation of internal air or external. The quantity of ventilated air needed for one person per hour is named as the volume of ventilation. The norm of the air cube in premises is 25-27 cube meter. The volume of ventilation 37.7 cube meter. Therefore, full removal of spotted air and substantiation is by pure atmospheric air is necessary to provide approximately 1.5 to a liquid change of room air with external per 1 hour. Thus, air change per hour are the basic creation of ventilation intensity. It's calculated by division of air quantity entered in premises during 1 hour by cube of premises. For patients, the volume ventilation at hospital bed is 30 cubic meter. At heavy physical job, the breathing increase. The quantity of exhalated carbonic gas is decreased, so volume of ventilation is also raised. At sport places, the volume of ventilation for one person is 90 cubic meter. At industrial enterprises, 70 cubic meter. Heating system in the hospital. Particular importance in the formation of hospital environment have heating system. Microclimate determines thermal state of the medium and depends on the temperature, humidity, air temperature, and mobility of the enclosed surface. Comfortable microclimate ensures ventilation and heating system. Heating system should ensure that the regulated air temperature and even heating during the day to exclude air pollution and to be comfortable for harvesting. In hospital usually provides central heating. Water with a water temperature in the heating device is not over 85 degrees. In more hygienic requirements are met by the radiant system, panel heating. Radiant heating is recommended for aseptic premises, operating room, maternity, neonatal wards, burns, infection. Hospital infection. Any clinically distinguished infection disease which amazes the patient as a result of its hospitalization or visiting hospitals with the purpose of treatment of the medical personnel by virtue of exercise or activity by it, independently because are shown or signs of this disease during finding of the given phases in hospital are not shown. Definition of intrahospital infection by World Health Organization. Intrahospital infection and secondary clinical disease caused by pathogenic microorganism which strike or an illness, the patient and the medical personnel in the hospital. About 5% of adults may be infected in the hospital bed because of intra-hospital infection. One of the main tasks of modern hospital is preventing of intra-hospital infection. The risk of intra-hospital infection is a complication of general condition of patient, prolongation of treatment period, increased lethality, additional economic expenses. There are a number of infections spread in the hospital, as intestinal infection and infection of respiratory system. Classification of intra-hospital infection. First, in relation to the causative agent and spread way, instrumental contact, direct contact, waterborne, airborne. Instrumental contact as a result of infection operation, after birth, transfusion, endoscopy, post-trauma infection, and other causes. Second, in relation to the level of spreading in the body. Divided two groups, general and local. General infection as sepsis, local infection as skin infection or pneumonia. The main causes of cross-infection, patient with chronic disease, bad sanitary situation in hospital, the illness, the medical staff, the instrumental method of diagnosis. Measures of intrahospital infection preventive can be divided on specific and non-specific. Specific, presented by immunization, scheduled and emergency, and non-specific. Non-specific measures preventing of intra-hospital infection include architectural and planning, sanitary engineering, sanitary and anti-epidemic, disinfection, sterilization, ventilation. Architectural and planning measures include zonation of territory or a hospital site, rational planning of units by floors and by corpuses, isolation of section, that's operating block, keeping the rule that the stream of patient and personnel shouldn't cross, sanitary hygienic measures, is a rational ventilation system, air supply, sanitary devices, air conditioning, sanitary and anti-epidemic measures, control over the sanitary condition in hospital, sanitary and educational work among the medical staff and the patients, early detection of the cases among the medical staff and the patients, control over bacterial dissemination in a hospital, disinfection and sterilization, using of the chemical agents, machining, using of the physical method, ultraviolet radiation, gamma radiation in hospital. The use of ultraviolet bactericidal radiation against infection disease. The use of ultraviolet bactericidal radiation in different types of therapeutic and preventive established is aimed at solving one of the most important problems of preventive medicine, what is considerable reduction of infection disease prevalence, including hospital infection, as well as providing sanitary and epidemiological well-being of patients. Ultraviolet bactericidal radiation is a part of the spectrum of electromagnetic waves, or wavelengths between 205 nanometer and 315 nanometer. The exposure of microorganisms to ultraviolet can cause destructively modified photochemical damage in the cellular deoxyribonucleic acid, which result in their death in the first or next generation. As it's well known, ultraviolet bactericidal radiation is extremely harmful for living microorganisms, which are responsible for the spread of airborne and droplet infection, such as tuberculosis, diphtheria, measles, flu, smallpox. At the same time, ultraviolet bactericidal radiation is often used in combination with some other disinfecting agents, for example, physical and chemical, that ensures adequate disinfection of hospital premises. The range of bactericidal lamps is nowadays much wider. There are lamps with low mercury content and non-ozone lamps. When applied, these lamps don't produce ozone, which is extremely dangerous for the health of people, especially for the patient with lung disease and children. Sanitation of air on hospital premises in the absence of people is usually carried out in bacteriological laboratory, operating theaters, dressing room, in laboratory at the chemists after cleaning. In this course, open labs, booth 15, booth 30 are usually used. The lamps are placed at a height of about 2.5 meters above the floor or evenly all about the room, or about the workplace, or in the doorways, where a screen of bactericidal rays is created. The number of lamps used for the sanitation of air and the duration of sanitation depend on the size of the room. The minimum number of lamps used for sanitation of air should be enough to cover 1 cubic meter of the area with 1.5 volt of the consumed power. The duration of the sanitation of air should be as long as possible. The minimum duration of the sanitation of air should be 15-20 minutes. Sanitation of air in the presence of people is the most effective way of sanitation because people seem to be the main source of bactericidal contamination of air on hospital premises. The sanitation of air in the presence of people may be carried out with the use of shielded bactericidal lamps made of uveal glass with production capacity of no more than 1 volt per 1 cubic meter. Therefore, Only the upper portion of the premises is irradiated. Shaded lamps are usually placed evenly all about the room at a height of no less than 2 meters above the floor in the places with the most intensive convection carries all the air, for example, above heating devices, doorways, and window frames. The total duration of the irradiation of air indoor should not exceed 8 hours per day. The optimal mode of irradiation should include free for irradiation altering with breaks to air the room. Thanks for attention.